Member for Caribou North.
Thank you very much, Honourable Speaker. It is my pleasure to rise today to respond to the member's statement on creating new midwifery training opportunities. We can all agree that this is vitally important so that expectant parents across British Columbia can access the care that is right for them. As the Shadow Minister for Post-Secondary Education, I welcomed the government's recent announcement of an expansion of training seats at the University of British Columbia. It is my sincere hope these additional seats will be able to meet the demands, as we know that there have been challenges in other areas of maternity care in this province. Peace Arch Hospital in White Rock finally saw a new doctor last fall, which was a big relief after staffing shortages in the maternity ward impacted a number of local families. At first, maternity patients were diverted to other facilities, and then came the news in early 2022 that the ward would shutter altogether. Soon after, the decision was thankfully reversed, following the announcements of significant new scheduling commitments made by the hospital's pediatric group and its partners. While we are certainly thankful that the situation was stabilized, we are all reminded of the extreme stress and uncertainty families faced for many months. Meantime, while residents in Surrey and White Rock have been hopeful that the new hospital coming to Surrey would provide much needed maternity services, they've learned that that will not be the case. With 2 young children under 2 years of age, Surrey residents Aaron and Tabitha Chan recently told CBC News that they were, and I quote, disappointed and frustrated that the new facility, minutes from their Cloverdale home, would not be offering this type of care. Tabitha rightfully pointed out that Surrey is a fast-growing community with many families with young children, and having a dedicated pediatric department at the new hospital would be one of the most important services it provides. Just last week, the Surrey Board of Trade expressed the need for more maternity and pediatric beds in the city. And the organization had this to say about services, and in general, and I quote, the new Surrey Hospital is projected to have 168 beds, bringing Surrey's total beds up to 802. Although this satisfies the World Health Organization's minimum beds per 1,000 persons in a geographical area, it still fails to satisfy the healthcare services and needs of Surrey. Individuals from other jurisdictions south of the Fraser also utilize Surrey Memorial Hospital, end quote. Despite some hints by government suggesting that maternity services could be added to the new hospital later on, if needed, a Freedom of Information search by the opposition revealed the following from Fraser Health, and I quote, as pediatric and maternity services are out of scope for the new Surrey Hospital and BC Cancer Centre project, there are no clinical services planning documents available that pertain specifically to this site, end quote. Honourable Speaker, these challenges in accessing maternity care are not just isolated to the Lower Mainland. In Kamloops, the Thompson Regional Family Obstetrics Clinic, which delivers 60% of the babies born each month in the city, has announced a permanent closure after raising concerns for nearly a year. These impacts will be felt deeply by families in Kamloops and those in rural communities as well, as demand for the clinic has increased as smaller regional operators have also lost doctors. Communities like 100 Mile, Lillooet, Barrier, and Merritt relied on services of this clinic, so there is much uncertainty for them right now. And I'll note the news of the facility's closure come less than a month after another clinic, Sage Hills Community Midwives in Kamloops, announced its closure. Honourable Speaker, pregnancy and childbirth can be a stressful and delicate time for many parents, particularly those expecting a child for the first time, or those facing high-risk circumstances and complications. Maternity care is just one more aspect of BC's healthcare crisis that requires immediate action and intervention so people across our province can see positive outcomes as soon as possible.